Colorectal cancer is a cancer of the large bowel. And oftentimes this presents itself as a polyp, which is in very many cases a precancer that eventually goes on to grow and turn into cancer of the bowel. What causes colorectal cancer can be different. We do know that from a genetic perspective, if you have a strong family history of colorectal cancer, that mutated genes could be passed on to the next generation and increase your risk of developing colorectal cancer at an early age. So one of the most important things is understanding your family history and knowing who in your family may have had colorectal cancer. They find that people who are obese, there's a correlation with diabetics also having a higher risk for developing colorectal cancer. They're also finding too that vitamin D deficiency may not necessarily increase your risk for getting colorectal cancer, but may have an impact in determining how well you do after you've gotten the cancer and gotten the treatments. Colon cancer tends to progress very slowly. It may take 5 years for a person to get from a precancerous polyp to colon cancer. And most Americans would get colon cancer in their 50s, late 50s, early 60s. So they found that screening for colon cancer at age 50 can help you to detect the precancerous polyps, and with a colonoscopy you could take those out and never get cancer. So the goal of colonoscopy is to make sure that people never get colorectal cancer. If you have a family member who got colorectal cancer at age 50, you should be screened for colon cancer 10 years before the earliest family member. So, I've seen people who've had mothers or fathers who got colon cancer at age 45. That means you need to be checked at age 35. So again, being aware of your family history and knowing when to initiate screening is very important. African Americans are also known to get colorectal cancer at an earlier age, and based on our current screening guidelines, may not get screened as soon as they should. Unfortunately, only about 40% of Americans get screened for colon cancer with a colonoscopy. And right now we're trying to get at least 70% of Americans screened. Because if you wait until you start to develop symptoms and this precancerous polyp turns into cancer, then at that point it's too late. You have cancer and then you'll need surgery and you'll need chemotherapy, and then a whole domino effect takes place. Usually the main symptom that I see is people start to notice changes in their bowel habits. So as they get older, a person who may go to the bathroom every day may all of a sudden begin to see that they're having diarrhea or that they're beginning to have constipation. Eventually, as it gets worse, people start to complain of abdominal pain, and you may actually see blood in the stool or dark black stools. So a lot of where we go next after a person has been diagnosed with colorectal cancer is we have to determine the stage of the cancer. The higher the stage of the cancer, oftentimes the more intensive the treatment. So if a person is diagnosed with a very early stage colon cancer, the treatment would just be surgery. If you have a higher stage colon cancer, then sometimes that might involve surgery and chemotherapy. Sometimes it might involve very intensive chemotherapy. But it really just depends on the stage that we diagnose a person with colon cancer. And again, the more people that go for their colonoscopies at age 50, the earlier we are likely to detect these cancers. If we could get everyone screened for colon cancer and we could detect these pre-polyps, these precancerous polyps, then we can make a marked difference in outcomes and how successful we are in terms of preventing cancer and catching colon cancer earlier. In terms of reducing your risk for developing colorectal cancer, the key component is lifestyle. Staying active, exercising, a diet that's high in fruits, vegetables, and fiber is one of the key components. New literature that's come out as well that shows that a baby aspirin every day can also reduce your risk of developing colon cancer. So in a lot of my colon cancer patients, I recommend that after they're done with their treatments, that they start taking a baby aspirin a day. A caveat to that, though, is you have to be careful that you don't have any bleeding risks or issues. But in general, for all of my patients who have no bleeding complications, I recommend taking a baby aspirin every day.